Hey guys, we all sweat. Some people sweat more, some people sweat less. And when the hot climates, we sweat more. And when we work hard, we'll sweat more. And tonight, I'm going to talk about oversweating, that is excess sweating, that is called hyperhidrosis. There are certain factors which increase the volume of sweating. Now let's check what are the factors. Factor number one is the body size. When you have big body size, then you will sweat more. Alright? And when you age, our sweat gland will function less. Then sweating will be less. And third one is when you have more muscles, you will sweat more. Because muscle will produce more sweat than fat. More when you have some health problem. You will sweat more when you have cold, flu, and when you are under depression or anxiety. These are the conditions you will sweat more. And there are conditions called hormonal fluctuations also can cause more sweating. Now the sweating also depends on the fitness condition. Fit people should sweat more, but that is natural. Do we sweat more? If you sweat more, that condition is known as hyperhidrosis. Excess sweating is known as hyperhidrosis. There are two types of hyperhidrosis. One is like localized hyperhidrosis and other one is generalized, that is secondary hyperhidrosis. And localized hyperhidrosis means it is sweating on only a specific part of the body. Generalized means all over the body. Most of the body part will have sweating. So what are the causes of localized sweating? Most of the people with localized sweatings will be having most in the palms and soles or on the axilla. So the cause of this is unknown. Malfunction of neurosystem is one of the reasons, and it runs in the family, and it interferes with day-to-day life, especially for the students. When you go to the classroom, they won't be able to write down, or with the people who are working in the offices, all the papers will be wet with the sweating palms. So that is localized. And these are the general sweating that is all over the body. The causes of these either can be due to menopause or during pregnancy or patients with cancer. They all lead to oversweating. Then pregnancy, already mentioned, and alcoholism. And diseases like diabetes, rheumatoid arthritis, thyroid disease and tuberculosis, Parkinson's disease, stroke and heart failure also can lead to excess sweating. That is generalized sweating. And some medications like psychiatric drugs, antihypertensives and even vitamins can cause oversweating. The peculiarity of this oversweating is that the sweating will be more in the night. Alright. So when do you seek advice? When you need help from the doctors. That is, when you have night sweating and you have generalized sweating, then you seek help of a doctor. And when you have sudden onset of sweating, when you have one-sided sweating and you belong to older age group, you need help. And when you change your medication and when you suddenly start sweating, then also you need help from the doctors. So these are the conditions. When you have generalized sweating or sudden sweating, when you are elderly and one-sided sweating, and if you have more sweating in the night and your sweating is more after changing medication, you need to seek help. Okay. Now, what are the treatment for localized sweating? The first one is some lotion, spray and roll on. It's called antiperspirants. So it will give you temporary relief. You can apply for the palms and soles and even for the axilla. And another treatment is called antiphoresis. In that we pass small electric current to the palms and soles, even axilla. That will control the oversweating, that is localized sweating. Especially the palms and soles is very effective. Only thing is that you have to go for 10 to 15 sittings in alternate days. That will give you very good relief. But there are chances of recurrence. But when you have recurrence, you can repeat the procedure. Okay. And some medicines are available that also will control localized sweating. Then another treatment is botulinum toxin, and it stops signals from the nerves which triggers sweating. Botulinum toxin is very expensive. The result will last only for 6 to 8 months. And there is one thing called electromagnetic energy, and the best treatment will be surgery, that sweat glands is removed or the ganglions will be removed. Now let's check what is the treatment for the generalized sweating. For generalized sweating, we have to treat the primary condition. There will be some underlying condition which can be serious and patient don't know about the underlying causes. That's where we like to worry about. Unfortunately, in our society, most people don't know that they are sweating more. They don't know that they have excess sweating or hyperhidrosis. So that is the main problem. So there may be serious underlying condition. In that case, especially when you sweat more, that is, you have more generalized sweating, and if you sweat on one-sided, and if you are elderly, when you sweat in the night, and when you change some medication and if you sweat more, that time you need medical help. That's all for tonight. I hope you understood about excess sweating as hyperhidrosis. I'll come back again with another interesting topic soon. Till then, please take care of yourself and your family. Namaste.